Understanding Anxiety in Kids, Tools for Managing Stress. Title: Understanding Anxiety in Kids, Tools for Managing Stress. Introduction. Anxiety is a natural response to stress, and it is not uncommon for children to experience moments of anxiety. However, when anxiety becomes overwhelming and affects a child's daily life, it can be a cause for concern. As caregivers, parents, and educators, it is important to understand anxiety in kids and equip them with effective tools for managing stress. This article aims to provide insights into the world of childhood anxiety, its potential causes, and practical strategies for alleviating anxiety in young minds, ensuring their healthy development. Understanding anxiety in kids. Anxiety is more common in children than one might think, with around 1 in 8 children experiencing anxiety disorders. While some level of anxiety is normal and even healthy, excessive anxiety can interfere with a child's ability to learn, socialize, and achieve their full potential. Recognizing the signs of anxiety in children is crucial for early intervention. Signs of anxiety in kids. 1. Physical symptoms. Children may exhibit physical manifestations of anxiety, such as headaches, stomachaches, frequent urination, muscle tension, and fatigue. 3. Emotional outbursts. Anxiety can manifest in emotional outbursts, including crying spells, tantrums, anxiety attacks, clinginess, and heightened sensitivity. 4. Perfectionism. Some children with anxiety will display perfectionist tendencies, often setting unrealistic expectations for themselves, leading to excessive self-criticism and fear of failure. Contributing factors to childhood anxiety. Understanding the causes of childhood anxiety can help identify potential triggers and offer appropriate support. Here are some common contributing factors. 1. Genetics. Anxiety disorders can have a hereditary component. If parents or close relatives have a history of anxiety disorders, there is an increased risk for children. 2. Environmental factors. Children living in high-stress environments, experiencing significant life changes, or being exposed to traumatic events may be more susceptible to anxiety. 3. Parenting style. Overly protective or controlling parenting styles can inadvertently contribute to a child's anxiety. Similarly, parents who model anxious behaviors may influence their children to develop similar patterns. Tools for managing stress in kids. 1. Open communication and emotional validation. Encourage open and honest conversations with your child, providing them with a safe space to express their feelings. Validate their emotions, emphasizing that their fears and worries are understandable. Encourage them to identify and label their emotions, which builds emotional intelligence and resilience. 2. Teach relaxation techniques. Introduce relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, visualization, or mindfulness activities. These tools help children regain control over their body's response to stress and promote a sense of calmness. 3. The power of play. Play is a natural way for children to express and process their emotions. Engage your child in various types of play, including creative activities, role-playing, and games that encourage problem-solving skills and promote emotional regulation. Art therapy, in particular, has shown positive outcomes in reducing anxiety symptoms. 4. Establish healthy coping mechanisms. Teach your child healthy ways to cope with stress, such as engaging in physical activities, enjoying hobbies or interests, and practicing self-care. Encourage them to identify and utilize these coping mechanisms when feeling overwhelmed by anxiety. 5. Create predictability and routine. Establishing predictable routines reduces uncertainty and promotes a sense of security for children. Consistent bedtimes, regular meal schedules, and structured daily activities can help children feel more in control and reduce anxiety levels. 6. Foster a supportive school environment. Collaborate with schools to create a supportive environment that understands the needs of children with anxiety. This can include implementing stress reduction strategies, providing suitable accommodations, and promoting positive relationships between teachers and students. 7. Seek professional help. If a child's anxiety persists and significantly impacts their daily life, consider seeking help from a mental health professional. Trained therapists can provide evidence-based interventions such as cognitive behavioral therapy, CBT, or play therapy to address and manage anxiety effectively. Remember, every child is unique, so it may take time and patience to find the most effective tools for managing their anxiety. It is crucial for caregivers, parents, and educators to understand anxiety in children and equip them with practical strategies for alleviating stress. By recognizing the signs of anxiety and understanding the contributing factors, we can provide the necessary support for children's healthy development. Anxiety, though a natural response to stress, can become overwhelming and interfere with a child's daily life. It is important to be aware of the signs of anxiety in kids. Physical symptoms like headaches, stomach aches, muscle tension, and fatigue can indicate anxiety. Behavioral changes, such as restlessness, irritability, sleep disturbances, and avoidance of social activities, are also signs to watch for. Emotional outbursts, including crying spells, clinginess, and heightened sensitivity, may be manifestations of anxiety. Additionally, some children with anxiety show perfectionist tendencies, setting unrealistic expectations and fearing failure. Several factors can contribute to childhood anxiety. Genetics play a role, as anxiety disorders can be hereditary. Additionally, high-stress environments, significant life changes, and exposure to traumatic events can increase a child's susceptibility to anxiety. Parenting style is also important, as overly protective or controlling behaviors and modeling anxious behaviors can contribute to a child's anxiety.